Welcome everyone. We are gonna start in a few minutes. Uh, there's already 26 people. Okay, welcome everyone. Thank you for joining us today. I think more people are coming, but we can start now. Um, so I am Arnaud. I work for EPOCH Practice, and I'm going to co-host this webinar with Sylvia and Saoirse, my two colleagues in EPOCH Practice. Today's topic, as you know, is rural homelessness. And maybe you noticed that the webinar is being recorded right now. So if you don't want to appear in the video, you can turn off your cameras. And before we introduce the first speaker, I'm gonna let Saoirse tell us a little bit more about EPOCH Practice and what's going on right now in the program. Saoirse. I don't think she can hear me, or maybe it's not working. Uh, okay. So I think I will do it myself. Uh, so this webinar is the third one in a series of 12. The two first webinar were on the recent US homelessness data and voting rights for homeless people. So they're both available on our YouTube account. Um, so the EPOCH Practice program is focusing on sharing evidence-based practices and policies. And we also work on facilitating the mutual learning between the member states and all stakeholders working on homelessness in a view, like with the goal to end homelessness in the European Union. We have a lot of activities that are still going on right now, and we have open applications for a training that is going to be on women's homelessness. It's going to be in early November, so you can still register to that. We also have an open call for inspiring practices that you can still submit to. And we're always very interested in knowing about what you want to hear in EPOCH Practice. So if you want to share an idea for a topic or like another webinar or activity, you can always send us an email or say something in a chat today. Um, so now we're going to welcome the first speaker. It's Mátyás Wagener. He's a sociologist and professor in UCLouvain in Belgium. And he's going to talk about the profiles of homeless people in rural Belgium and the different forms of living conditions. And all that he's going to say is based on point-in-time homelessness counts in Belgium. So you can send your questions in the question Q&A section, and we're gonna have a Q&A section at the end of the presentation anyway. So thank you, Martin, if you want to go ahead.
Hello, yeah, thanks for giving me the word. So I've prepared quite a big presentation about the homelessness counts in Belgium, and I will go very quickly about the first part about saying what we're doing in counting homelessness in Belgium, and then chip on to what's more the rural part of Belgium, in part in Wallonia, with a specific focus on the province of Luxembourg, which is one of the most rural provinces in Belgium. And so the idea is, for those who don't know Belgium, we're a country with 3 different languages, different political authorities, and I will speak today mainly about the Walloon region, but we're doing counts in all 4 regions of Belgium. And sometimes when I compare with the bigger picture, I would say it's Belgian data, and the other times it's Walloon or Luxembourg data. So one thing is with the counts, when we go back 6 years ago or 10 years ago, there were not really comparable statistics. There were some statistics, but it was impossible to harmonize them. And let's just say at one moment in Brussels, when I started working there in 2008, 2009, there was estimations went from 300 to 60,000 homeless people. And so it was really not very possible to make some to speak about homelessness in a correct way. And then we had the change in Belgian law in 2014, when there was the idea to take EPOCH as a common definition of homelessness in Belgium, and also with the will to gather much more better quantitative data. And for those who don't know, just a quick shortcut on what's EPOCH Light. And it's really important here. The first 3 categories are more classically known as people in public space, emergency accommodation, long-term shelters for the homeless. But the category 4, 5, and 6, we draw a lot of attention to this in Belgium. Because on the one hand, people leaving institutions, that will say people who are in institutions, but we could get out, but who stay longer in these institutions because they don't have any housing. And there's a lot of non-conventional housing, where we'll speak a little bit more today, that will say people are living in barns, in garages, and things which will say more easily, which have 4 walls, but which couldn't be seen as real housing. And then the 6th category is people who stay temporarily with friends, family, or third persons. And I will have some about this. And in Belgium, we added a 7th category that will say people who have a threat of eviction, who will lose their home within a month. So, and this is at the one hand looking at precarious housing situation. It's also at the territory, with an idea about one day in the year, that's always end of October, we take one picture of a broad situation. And so it's a service-based approach that will say employees, social workers from a lot of different sectors fill in questionnaires with the people or without the people if they have a good knowledge of the situation. And as you can see here, with a lot of broad view of services who fill in these questionnaires, there's classically the services for the homeless people, but a lot of other frontline services, public welfare institutions, health institutions, but also prisons. We're speaking with railway police, different set of low threshold services, and housing agencies, which gives us much broader vision about homelessness. And let's say, in comparison to the data we get from the classic homelessness services, we have 40% at least people which are in precarious living situations, but which are not in contact with homelessness services. And so, yeah, and the questionnaire is quite broad about different living domains, which makes it also possible to see how the people are living and where are they coming from. And one of the main part is the confidentiality, and that all data are anonymous. And yes, so you can have a look at this more in detail. And that's here's the part what we have been doing in Belgium. You see the different colors for different years. We started in the beginning with 4 cities, and then 4 cities in 1 province, and then it got much more broader. And now you see in 2024, we have a big part of the territory of Belgium is counted. And yes, and also, as we hear in the EPOCH conference, it's together with Firenze, the KU Leuven, which is the other Belgian university, and 11 universities and the European Observatory of Homelessness. We're doing counts in 11 countries and 14 cities all the way over Europe. which is a very interesting practice to compare homelessness in all these different cities. So let's go back to Belgium. This was quite of the beginning part. Overall, we did this 2 years ago, a comparison on all counted people in Belgium. And what we saw there, it's first that mental health, use of drugs, and mental handicap were quite a little lesser presented in little municipalities that will say where municipalities where lesser than 15,000 people live. But on the other hand, they are still present. And so it's impossible to show all the data here. But here we made extrapolation that will say we extrapolated the data we had to give a vision about all the big territories of Belgium in Flanders and Wallonia. And when you see in Flanders, I draw the attention, there are only 11.2 and 19% of homeless people in municipalities below 50,000 or 30,000%. But when you look at Wallonia, you see that 55.1% of homeless people live in municipalities with less than 300,000 inhabitants. And that was quite, for me, who is working on this since nearly 20 years, a little bit shocking to see. They often say in public debates, oh, we don't have homeless people. We're in rural areas and everything is going fine. Sometimes there's a fire problem. And then we're looking at that 55% of homeless people of Wallonia are just living in these little municipalities. And this got a lot of attention from politics, but also from us researchers to have a more detailed look. And so overall, in all Walloon territories, you could first say 1/3 of all the homeless people or badly housed people are women. It's nearly everywhere. It's 1/5 are aged young people, aged 20 to 25. And the proportion of the most visible people sleeping outside, sleeping in public spaces never exceeds 10%. And it's mostly in cities that we see bigger proportions of that. And people staying with relatives, friends, or third persons are always between 1/4 and 2/3 of the persons in Wallonia. And 25% of people don't have health problems. So we counted a bit more, well, 1/3 about the Walloon population yet. And when you see, I will switch this because I have the same slide just next to it. What's very interesting in Wallonia, here's just the number of people who are living in these municipalities. And you could see that 65% of all Wallonians live in very little municipalities, below 30,000 people. And so versus 55% of the homeless people. So there's some kind of underrepresentation of homeless people, but on the same time, they were quite well present. And you see in the right side, you see the number of counted homeless people per 1,000 inhabitants. And there you could see that 3.1 in the little municipalities, and it goes up to 6.2 in the biggest cities of Wallonia, which is Charleroi and Liège. And so this is really interesting to see that homelessness is a little bit more present in cities, but is also quite present in rural areas. And what was really interesting in Flanders, we had 1.7 per 1,000 inhabitants in little municipalities. And in Wallonia, this was much more bigger. And for those who don't know Wallonia, we have much bigger socioeconomic problems there. You see the yellow axis there is the old industrial axis. As we say in Belgium, entre Sambre et Meuse, between the two rivers, where most of the homelessness services are collected and where is a lot of poverty in these cities and around it, as we faced a strong industrial decline the last 50 years. And the white part, this is the part I will speak today. This is the part with the least density of population. Behalf of 3 municipalities which are just next to Luxembourg City, where a lot of people working in Luxembourg live. But for the rest, it's a very big forest, and so little towns, and so and we have a look at these cities there. And here, if you can see well, it's the part of homelessness people seen by the size of the city. And when you look at the more green spaces, you see that the part of people in public spaces and emergency accommodation is quite bigger when people are in big cities. And so you see lesser people really outside in emergency services, also because they have lesser emergency service, but also lesser people in the public space. But when you look at little municipalities, you see a lot of people. It's the biggest category who are staying with friends, family, or thirds, and people in shelters. In shelters, especially in the rural situation, are also people who are living in transitional housing from public welfare centers because there are not so much official shelters. So now a little zoom on the province of Luxembourg. And what we see there, the proportion of people there, 30% live in shelters, which are mainly situated in the two regional centers, which are quite little cities. But also 1/4 of the people live in unconventional location, tent, Garrett, squat, and also a little bit more live with third parties. And so 52% of the homelessness population don't really live in services for the homeless population. And it's also a little bit the same for children, but children are much more often in sheltered situation, but also live in unconventional housing situations. So, and I won't go into detail about all the data, I just put it there, but it's for us what was the most important thing to see. There's quite very few differences between the province of Luxembourg and the rest of Belgium. The only main difference is there are 10% of people are working in a classic job, and in main Belgium it's only 3%. But for the rest, the persons who have mental health problems, who have drug abuse problems, the people who went out of prison, of psychiatric hospital, of youth welfare services, is always quite the same in the different regions. And you could also see that people with 2 years of homelessness and mental health drug abuse, that will say classic housing first publics, persons, housing first profiles are quite present also in rural areas. And we gathered a new profile, which is low threshold profiles, that would say people in public spaces, emergency tents, quads, cars, and so. And they're also nearly 12% in rural areas. And so for those who want to read, I have put some interviews there, but I don't have the time, so I'll go a little bit quickly on it. But you see there's also the problem of youth who are dropped out from youth welfare services, who don't find a home, other young people who are just thrown out from their parents' home. And you see a lot of different youth stories. There's also a big problem in family and housing. What I also wanted to say in youth was also that they live sometimes, have a rent, but they invite friends who are homeless. And so they get more housing problems later on and get evicted from this housing. And so, and this is a quite interesting example from Cyril. All the names are changed completely. And so he had the building, but it was being squatted and destroyed. And so he lost, in fact, the building because he invited, or it was invaded by other people, friends, relatives, third parties. And I wanted to highlight a little bit this, because this category, living with friends, family, or third persons, is always seen as a category of nice family solidarity. But we see a lot of precariousness problems there, and also people who suffer to find a place or to keep the place for their own. And so they are very precarious situation. And especially for women, you see there's a lot of exploitation and sexual exploitation who is also in this category. You have a lot of migration pattern. In Belgium, you would say, yeah, but most migrants are in the big cities, which is numberly based on the big numbers, because it's true. But you see also there's a pattern of different migration trajectories also in the rural areas. And so, just to conclude now, time is running quickly. You could see, first of all, homelessness and lack of housing are also a rural phenomenon. And what is really interesting, the data and the description of the different profiles of people are not really different what we see in big cities. Main difference is in big cities, you have a lot more public space and emergency where the people are. And in rural situations, they seek more out to to barns, to old housing. In next to a rural center in Belgium, which is Allo, there are 20 young people who are living in the tents in the forest, and so they're much lesser visible, but they have quite the same precarious living situations, precarious profiles than in other parts of Belgium. And so there's a big question about lesser services, a lot more mobility problems, because you mainly need a car to go from one place to another, but they don't have. And then it's also, as the regions are more little, there's the presence of stigma that a lot of people tend to being more invisible and to not show the stigma of homelessness. And that's why, and yeah, the representative from the platform from Luxembourg is also here. For them, it was a big moment of recognition of the rural aspect of homelessness, because they say it for years that they're also the part of homelessness is important, but it was really difficult to bring this into the public debate. And as we had data on it, yeah, it could be shown more easily. Okay, there are this number of people with this types of problematics, and it was often in the public debate that mayors or aldermen said, oh no, we don't have this here, we have some problems there, but now it's yeah, the public debate is changing. So I have my 15 minutes finished up. Thank you for your attention, and I switch back to all of you.
Thank you very much. Can you hear me? Yeah. Thank you.
Yeah, I can hear you.
We have a few minutes if there are like questions right now, but if there are no question, we have another Q&A section at the end, so as you want. I didn't see anything in the chat, unless I'm wrong, Sylvia? No? It's a lot of information to digest, so
I was quite quick, sorry for that.
very clear, no questions. How nice is it? Saoirse, are you back?
I'm back. There's always one person with technical problems, and today I was the chosen one. Okay, so if anybody does, thank you, Martin, first of all, for that very interesting intervention from Belgium. We can maybe keep thinking of our questions, and then we'll also ask you at the end. I think maybe it takes a minute to digest the information. And then also next up, we can compare and contrast Martin's research on Belgium with research and practice from England, as we have two speakers joining us from the UK. We have Rory Weal, who's chair of the Rural Homelessness Counts Coalition, an initiative established to raise the profile and solutions to the hidden crisis of rural homelessness in England. And he's joined by Jason Garrett, the Community Support Services team leader at Shelter Dorset, to give us the perspective of working in rural services on the ground. So for the next 30 minutes, I'm going to hand over to Rory and Jason, whoever is taking the lead first of all.
Good morning. Is that me, Rory, or is that? I think it's me. Is that?
I'm happy with either, Jason.
Okay, I'm gonna share my screen, so bear with me. Good morning, everybody. It's morning here in England. I guess it's is it afternoon in Europe? Can you all hear me okay?
Yeah, it is. It's after 12 p.m. now.
And can you see my
yeah.
Can you? So yeah, good morning. I'm here to talk about the realities behind rural homelessness. And I'm Jason Garrett. I work for Shelter Dorset, and I am responsible for managing the teams that deliver our Housing First services in Dorset. So for those of you who are not familiar with Dorset, Dorset's a rural county in the southwest of England. And that top picture is a picture of Dorset's famous Jurassic Coast, and that's the Golden Cap. It's a really popular tourist destination. Dorset is well known for its area of natural beauty. And the picture below is of a rough sleeping site in North Dorset in woodland. So what's the difference between rural homelessness versus urban homelessness? Rural homelessness is hidden. People are often in remote locations, barns, fields, woodlands. It's individual, it's dispersed. People tend not to congregate and are kind of found in villages and small towns. People are well known. They're quite often born and raised in the towns and villages that rough sleep in. There's discrimination and there's stigma. There's poor transport links quite often in rural areas. The buses are very far few between, maybe one or two a day, and often in smaller areas there are no train lines. There are particular issues for women. There are a lack of gender-specific services for women to access. Often women will put themselves in riskier situations to find somewhere to stay. There will be transactional issues, and it's difficult for women to address personal hygiene resources. There's a lack of emergency accommodation in rural areas. More often than not, there's no temporary accommodation provided by the local authority. There are no night shelters, and there are no hostels. Whereas if we talk about urban areas, it's more homelessness is visible. It's seen, it's on, traditionally it's on streets, in shop doorways. There's more of a homeless community and people have companionship. So there is some safety in numbers. People are often anonymous, they're not so well known. It's visible, but they're not so well known. So their histories, their personal life is not known by people that pass them. There are regular transport links. People are able to access services more frequently and when required. There are more specific services for women, specialist domestic abuse services, women's groups, women-only services, community centres for women to address their personal hygiene issues. And there are more available local services on a daily basis. Job centres, drug and alcohol services, community centres, local authority housing. And there's a larger range of housing options. There is a more temporary accommodation, there are supported accommodation options, and there are hostels and night shelters. So one of the issues that people have told us that they find a challenge in rural areas is social isolation. In bigger towns, there are more services and there are more people to talk to and meet. There's a larger homeless community, and quite often that can be of benefit to people. People feel safer in numbers. Rural areas, people need to go further afield to find a safe sleep site. And that in itself makes them more isolated. It can put them more at risk of getting to that site. It's lack of, they can be hidden, and emergency services, if required, can't get to them in time. It's just more of a challenge to find somewhere safe to sleep and be with others. People have told us as well that the thought of moving to a bigger area where there are more provisions and more accommodation and more services can exacerbate their mental health issues. People have said to us that they become more anxious, that they can feel depressed. Their well-being is affected. Just their general mental health. The thought of leaving their local area just exacerbates their mental health. And also, I mentioned earlier that most people in rural homeless, suffering from rural homelessness, are from their local area, are brought up in that area. So quite often, leaving their community, family and friends, they can become more isolated. So any social networks and support that they do have is in that area. And on the right hand of the screen here, we've got, these are actual quotes from people that shelter support. So someone told us, we need somewhere where people can congregate and go to daily. The services that are here only operate occasionally. Someone else told us, I want to stay here, you know, I want to get my life back together and build links with my family. And then the last quote on this slide, someone indicated that the buses are useless in the sticks. They only run every hour and a half, and if I had an important appointment, job centre or probation, I'd be late, and that doesn't look good, and I could get into trouble. So what are the difficulties in accessing services? So mainstream, most services in Dorset are set up for urban areas. So which are able to be accessed on a daily basis. It can be challenging to find people in urban area, in rural areas due to geographical location, due to sleep sites being quite remote. Street outreach teams have limited resources and time to access rural areas. More often than not, the resources are based in the large and urban areas, and it can be difficult for services to get out to people. It can be quite a distance, and quite often when people do get out there, often, as we've seen in rural areas, people move their sleep sites more often than in urban areas. And time and resources can be challenging. People have always also told us, and we see that there are limited service availability in rural areas. So if there are services that operate, then those services only operate maybe on a morning or an afternoon once or twice a week, and people find it difficult to get there. So again, we've got some quotes from people that we work with and that we've worked with. Someone has stated that if I'm hungry, there's nowhere to go, no soup kitchens or anything like that. Someone else has pointed out that there's only a couple of you, there isn't enough people, so services don't bother. And somebody else has pointed out there's only a couple of services that are in the area, but they're only about a couple of days or once a week. So there is a limited availability of suitable accommodation in rural areas. And rural areas lack single occupation accommodation. They're far and few between. There's a lack of one bed or studio flats. When private rented homes, it's difficult to access quite often in rural areas, again, because people are known and there's a notoriety and there's the stigma and there's the they're quite known, and the discrimination. Private landlords are not willing to take them on. It's also expensive. The guarantor, the deposits, the rent in advance. As I stated earlier, there is a lack of emergency and temporary accommodations. There are no hostels anywhere in Dorset, and it's difficult for people to access social housing. There's just a lack of single homes. Again, there's the notoriety, and people are often, because of their homeless situation, they're often not on housing registers, or they've not been able to access the local authority housing teams, which would get them on that social housing ladder. So again, there's a quote from somebody there who's indicated there aren't any bedsits or one bed flats in the area that I can rent. If I wanted to rent somewhere, it would be private landlords, and I would need about £2,000 to be able to get somewhere. So how are we tackling rural homelessness in Dorset? So one of the interventions that's worked and has been beneficial that I'm involved in is the Dorset Housing First service, which is keeping people in their communities and where they'd like to be. We've been operating in Dorset for about 6 years now, and part of our contract is to deliver housing first in rural Dorset. And we've achieved this by working in partnership with housing associations, local providers who have signed up to a service level agreement in partnership with Dorset Council and Shelter. And we've managed to support people to maintain their tenancies for a number of years in the area of their choice. We have enabled people to re-engage with their communities and with their families. I've mentioned there about social re-enablement. So we've worked with people that have had family breakdowns, and by being able to stay in their area of their choice and their preference, they've rebuilt ties with their families. And Shelter follow the Housing First principles set out by Homeless Link England. And some of those that I've just mentioned are choice and control, person-centered, and that's allowed us to deliver an effective service and allowed people to stay in the homes of their choice. That picture there on the right-hand side of the screen is actually the front door of our very first person that we housed in rural Dorset. Shelter Red as well. So what's the benefit to our Housing First clients? As I mentioned before, we deliver that person-centered choice and control, which allows people to live in the areas of their preference. We've worked with people that have been homeless for a number of years. As it says there, one person was out on the streets for 10 years. We've worked with people in Dorset that have lived in woodlands for a number of years and are maintaining their tenancies for long periods of time. So as I said, somebody there's put they were out on the street for 10 years. This is feedback we got about our service. I had an element of control as to what my housing would look like. I got what I asked for, so I felt I was being listened to. And I mentioned about person-centeredness, that ongoing support and me being at the center of it, that works. And again, for those of you who are familiar or not familiar with Housing First, it's an offer of open-ended support. So the support is there for as long as required, and someone's put it's been beneficial to have the open-ended support. So how else are we tackling rural homelessness? As I mentioned earlier, we're working with partners. We work with not only with the local authority, but we work with the registered providers who provide accommodation of individual's choice in rural areas. We take a collaborative working approach. We work really closely with Julian House, who is the street outreach team. We work with the homeless health outreach team, and we work with the local authority. We work with the drug and alcohol services. There is an outreach service called Reach Out, which shall have a drug and alcohol worker attached to our service, and that drug and alcohol worker is able to go out to people along with some of those other partners I mentioned. We are bringing the issues to the attention of the local authority. Shelter are part of a local homelessness forum, and we are opening people's eyes and challenging the stigma attached to rural homelessness and discrimination. We understand the individual and put the individual at the center of everything we do, and we try and get other services and other people to look at that approach. So I've got a couple more quotes on the right hand of the screen here. This is a quote from one of our service users who said that his working with Housing First was very different from his other housing experiences, which were far from idyllic, when he was removed from his local area and family and moved to a more urban area. And he prefers being where he is now. This was a gentleman that was accommodated in, that lived in woodlands for between 3 and 4 years because he didn't want to go to an urban area, and he's now maintained his accommodation for over 4 years. And the other quote that I have there is some feedback from one of our partners, Sovereign, who are one of the providers who provide the accommodation in rural areas. And they talk about building and developing effective joint working relationships with the police and Reach, which is a drug and alcohol service, and them having an understanding of the Housing First approach. And that's it from me. Thank you very much for listening.
Thank you. Thank you very much. Rory, if you want to continue.
Thanks, everyone. I'm just sharing my slides. Can you see that okay?
Yeah.
Great. Great, and thanks, thanks, Jason, for covering a lot of that just then. And it's really good to be here today to present some of our work. So my name's Rory. I'm the chair of the Rural Homelessness Counts Coalition, which we set up a couple of years ago to respond to the kind of rising levels of need we were seeing in rural communities. And I work for English Rural Housing Association, who support this initiative, and have worked really closely with Jason and others as we've developed it. So obviously previous speakers have kind of covered things from kind of an academic perspective and a frontline perspective, and I'm going to be talking about the work of the coalition, but also some of the kind of policy changes that we're wanting to see too. But before I kind of launch into that, I guess it's worth just building on what previous speakers have said and recognise that often when people think about rural areas, this is particularly the case in England, but I'm sure it's the case in other countries too, their image is often of kind of an idyllic setting, kind of very harmonious, very sort of peaceful, and often quite affluent too. So these images here kind of paint that picture of how often rural communities are depicted. And the picture you'll see on the right, those of you probably from the UK may recognise this as an image from the kind of Hovis advert in the 1970s, Gold Hill in Shaftesbury, which kind of became very famous, but in many ways kind of represents that image of rural England. And this is the patch that Jason's been talking about just now, and kind of went to that area, that part of Dorset, a couple of months ago. And this is one of the Shelter Dorset team's clients, Chris, and in that same spot, which is so famous for its kind of often quite affluent, rural, idyllic quality. He's been sleeping rough. He's been sleeping in a tent just outside the town, and this is part of a project we've done to kind of capture the images of homelessness that are out there, and to challenge sometimes the more kind of urban-centric depiction of homelessness, which we see in a lot of our press and media too. It's far more common, I think, to kind of see homelessness depicted in the media and by policymakers like this. So these are kind of some of the images when you kind of search in the media for depictions of homelessness. You can see that visible, rough sleeping in towns and cities. Often it could be begging, and often the depiction is perhaps it's a middle-aged man, perhaps a white man, and while that experience is certainly out there, and many people fall into that category, we actually know the experience of homelessness is a lot more diverse than that, both in terms of the kind of gender and race of individuals, but also in terms of the geography. And I think that the presentations today have kind of really brought that to bear. As others have said, and I think this really kind of builds on the points of the first speaker, that actually homelessness in rural areas, yes, it can include some visible rough sleeping, but often it is a lot less visible. We're looking at kind of tents, outbuildings, woodlands, and also sofa surfing, and people living in vehicles too. This overall picture from the research we've done kind of shows that lack of visibility means that people are often unsupported and isolated, and the unaffordability of many rural areas is kind of compounding this and creating a rural homelessness crisis. And through our work, we've been speaking to people who have direct experience of rural homelessness, and some of the major considerations that they have to make every day. This individual, Frank, who's worked with us really closely, as you can see here, he says, "I've decided to bury myself deep in the woods, train the problems for city life for those of rural areas. Soup kitchens and community hubs were no longer accessible, but on the other side, I escaped the risk of abuse, drugs, and police encounters more common in urban areas." So you can see that actually some of those challenges in urban areas are kind of pushing people out of those environments too. But as this quote shows, and as Jason has just touched on, there's a real lack of support in those rural areas. And that's something that we're really keen to address. So as a coalition, we commissioned some research that was undertaken by the universities of Kent and Southampton. And some of the major findings here were, in England, we see a big gap on a per capita basis on funding for homelessness prevention. And we know urban areas themselves are very underfunded. So to see a 65% fewer amount of funding is obviously quite concerning. We've seen a kind of year-on-year often rise in rough sleeping in England in recent years, and in 22 to 23 we saw a 24% rise in rural areas. So it's clearly a problem which is growing. And from conversations with people working on the front line, those survey respondents saying that it's become harder. So in England, we've had significant budget cuts in the last decades to many frontline services, homelessness services, but also mental health and other support functions. And that kind of has contributed to this rise in rural homelessness that we've seen reported. Just another quote to share here from an individual who wanted to remain anonymous, but they said, "Rural homelessness is by far one of the worst things. Nobody knows you're there. Nobody cares you're there. You're on your own," which is obviously a really difficult thing to hear. But I think it's why the conversation we're having today is so important, to shine a spotlight and to show that there's actually a lot of connections internationally. And certainly from the presentations today, that's already very clear to me. And I want to just touch on that, the value of international approaches here, particularly on something that often gets neglected in the national context. The work that we've done initially started from a fellowship I did looking at rural homelessness in the United States. And that was clear that there were a lot of common experiences. There were things that were different, but what kind of shifted the dial and what actually created in many states a big reduction in levels of rural homelessness was greater awareness was the first step, which is something we're trying to do. It's also kind of strong central government oversight and allowing communities to kind of then also take the lead in their spaces. So that kind of top-down funding, support and attention, but also empowering often non-profits as lead agencies in their local areas to design the kinds of interventions which are most appropriate to their communities. So given all of that, we decided to set up this coalition. This has got a variety of kind of charities signed up. We've got homelessness services, we've got rural representative organisations, we've got voices from local government as well, kind of coming together to say that we have this resolve to tackle rural homelessness. And what do we do as a coalition? Well, the main things we aim to do is to foster partnerships. So we know that, as the previous speakers have said, these issues are really closely connected. Housing, mental health, transport. So it's really important to bring those partners together to raise awareness and also develop and advocate for the solutions that are needed and to make sure they're evidence-based. So in the rest of my presentation, I'm going to talk about what some of those solutions at a local level are and the evidence base behind that. So there's obviously kind of big solutions to homelessness in rural areas that are about kind of tackling unaffordability. So kind of building new social and affordable housing, increasing the investment we have in the system. I'm going to talk not today about those kind of really big picture policy changes around welfare and housing, but what individual local government organisations can be doing in the here and now. So what we did with the Local Government Association in England is we held kind of workshops with these local authorities, and we produced a guide which had evidence-led approaches to tackling rural rough sleeping. And there were three themes that came through from this work. So the first theme was the value of investing in a flexible and expansive model of outreach. So I'm sure this is obviously something we have in different European countries, but the outreach services which kind of go out there, identify people that are sleeping rough and connect them with support. The second theme around the role of data and the importance of kind of building better data to make the case for interventions, and then kind of effective governance too. And I'll just talk about each of these in a little bit more detail. So that first stream around investing in a flexible, expansive model of outreach, well, that's important because the problem we've identified and which Jason just touched on is limited rural provision. Outreach teams don't have the capacity to be going out into woods, into villages. And that means that we don't even know the people that are out there. And we, at least in the way our system works in England, don't have good data as a result on who's experiencing rural homelessness. So some of the solutions that came from the workshops are building a network of community referrers in rural settings. So what that means is being a bit more imaginative. It's not just homelessness services that are responsible, but thinking about churches, thinking about post offices, thinking about the parish council. These are kind of local entities that will have knowledge, and it's really important to kind of bring them in and support them to make referrals when people experience homelessness. There's a role of technology here. So some people may be familiar with What 3 Words, which allows you to more accurately identify a place in a rural area without the need for an address. That's really important, I think, to identify the locations where people are experiencing homelessness. And then reducing verification barriers. In England, to access support, often you'll need to be verified as sleeping rough, which means that an outreach team has to see you sleeping rough and therefore confirm that, and then you get support. In rural areas, because the outreach teams just don't have the capacity, it's important to not do that kind of high threshold gatekeeping and instead take a kind of balance of probabilities approach. Think, okay, this person, we've heard that they are rough sleeping, we're going to take in trust from that individual organisation that they are, and not need to make the individual meet a very high threshold before accessing support. And we have something in England called StreetLink, which allows people experiencing homelessness, but also the public, to refer people. We need to kind of build awareness of these tools in rural settings because they're much less frequently used there. The second theme around kind of better data, I've mentioned how often rural areas don't get the funding because the data shows low levels of need, but that's just because it's hidden. So we need to kind of tackle that through more regular data collection. We need to kind of use different technologies to show the levels of need in different communities. And crucially, we need to capture kind of hidden forms of need too. Often the more visible rough sleeping counts don't pick up people whose housing is more transient. Maybe they're moving from a shelter into maybe the woods, or maybe then sleeping with friends. So these kind of transient experiences. We have something that's been pioneered recently called the Women's Rough Sleeping Census, which is aimed at identifying women that are rough sleeping. As the speakers have said, often less visible. And that takes a much broader view of rough sleeping, and it brings in a broader range of partners who have the knowledge of where those individuals may be sleeping, whether that's kind of in transport, whether that's in less visible environments. So that offers a model to scale up. And also evidencing needs and cost savings. So really important to get the support from partners. The third and final strand, I think I'm doing okay for time, Honor, but let me know if we're running over. So the third strand around effective governance to make rural homelessness a priority. So in England, the responsibility for homelessness is with local authorities, but many rural local authorities haven't historically done that much work to tackle rural rough sleeping particularly. So we need a big drive to kind of build that understanding in rural local government, which involves having a rural input to every kind of local strategy. It involves working with kind of health system as well in the development of those strategies, and partnering up with neighbouring local authorities, local councils who maybe operate in the more urban areas. So kind of partnering up, sharing insight and expertise, and addressing often the movement that happens between rural and urban areas. These are often interdependent, so we need solutions which work across those areas, not just in the urban areas. And finally, kind of raising awareness locally to tackle kind of stigma and the limited awareness of support in rural settings. Just before I kind of come on to final slides, just to give you an example of some of the initiatives that are happening out there. So in the New Forest, the district council has put a mental health nurse in its homelessness team. And the idea here is to provide whole person support when people in the New Forest face crisis. As the name suggests, this is a very rural area in southern England. But by bringing that nurse into the team, it's meant that they can work much more flexibly, and the individuals don't have to kind of get public transport, which takes a lot of time, is expensive, maybe they miss appointments, but that support is actually integrated into the housing and homelessness team. And that's led to some really great results as a result. So we've seen really positive outcomes even in the first few months in which this data kind of came from. So these are the kind of things we need to do more of in rural areas. That collaboration in rural areas is particularly important, given how fragmented and isolated communities are. So what next? Well, I showed that slide at the start of Chris in Shaftesbury. We've got a whole kind of photography project which is going to be raising awareness of rural homelessness. So we'd obviously be really keen to share that as a moment to kind of change people's attitudes and minds. We're also working with Homeless Link, who are a homelessness membership organisation. We're setting up a new community of practice, which is aimed at bringing together all the people that are working on this, because often what's happened in the past is people have been very isolated in their communities, doing great work. We haven't had a dedicated space to bring together all of that thinking and to share that knowledge and insight. So that's what we're going to be doing. We're going to be running 6 sessions over the next year, which is very exciting. And if you'd like to hear more about that, you'll have my kind of contact details. If you'd like to be a part of that, do get in touch. We can add you to the mailing list for the coalition and share some of the slides and the guide I've got afterwards. So yeah, it's great. It's great to kind of pull all this together. And if anyone in the chat or in questions wants to share anything you're doing in your community, we're always really keen to build our bank of best practice and knowledge, because I think what's been revealed to me in these presentations is actually how similar many of the challenges are, and particularly like really interesting hearing about Belgium and the fact that actually what we're talking about is the level of need isn't different, but it's that less visible form of homelessness. It's still really dangerous and it's still really precarious, but that requires us to think a bit differently about what homelessness is and our conception of it. And I think we could probably do that kind of across Europe together. So look forward to being a part of that conversation going forward. I'll leave it there.
Thank you very much. It was very interesting. I'm sure there's going to be a lot of questions in the chat. But first, we wanted to invite 2 people to react to those presentations before we do the question from the audience, if that's all right for you. The first person is Mátyás Szabó. He's a policy officer from the DG Agriculture and Rural Development in the European Commission. And the second person is Donna Young. She's the coordinator of Rural Housing Scotland, and she will talk on behalf of the European Rural Communities Alliance. Maybe for 5 minutes, 5-10 maximum. Mátyás, do you want to start reacting and maybe presenting a little bit more what you do, the Commission?
Fine for me. Thank you very much. I hope you can hear.
Okay. Am I the only one not hearing anything? No? Okay.
Yeah.
Frozen.
No, I'm just getting back. I'm just getting
You're back.
in a very, very urban Brussels city center, still lacking the internet sometimes. So thank you very much for the presentation. Very learning, very eye-catching, and I do hope we will get them. So to be short, and I wanted to react from 3 point of view, to put you in a little bit in a context what we do. Did you agree in European context? 3 different angles where from we are reaching this topic, important topic. First of all, we have the package of the agriculture and forestry workers, which are a very, very hot topic, not only today, but it's a kind of evergreen hot topic for us. The working and living conditions of these workers are very important topics for us, and give us daily jobs, because these most of the cases seasonal workers are very often undeclared, very often in big proportion third country nationals, and most of the cases illegal workers. These workers in the rural areas are very often are settled in a very bad situation in terms of housing and accommodation. I can say I just learned these types of Mr. Wagener. The very different. Most of these workers are in different category of these rough sleepings, but which is equal is that in most of the cases it is not proper and not human. Let's say it like this. This is the first package which I wanted to mention. The second one is the lack of services in rural areas in general, the lack of services lack of social services in rural areas. Mr. Garrett also referred and showed the same problems and challenges we do have on the continent, not only in England, but or United Kingdom, but in the continent. And of course, these social services are tackled or addressed in most of the cases by the European Social Fund in the EU, but also the common agriculture policy has also some roles here. And we do have a bottom-up approach and rural development tools like LEADER approach. But the problem, as I see from my position now and listen to your presentation, is the participation of I would never say organizations, but the participation of homeless people and the NGOs supporting them in these rural development communities are very low. I must tell you, very low, and the limited resources are most of the cases allocated on very different social inclusion, if at all social inclusion aims are targeted. It's most of the cases, or let's say almost never targeting homelessness in rural areas. On the third point, and this is, let's say, divided by two. The third point is on depopulation and aging in general in rural Europe. I must tell you that this phenomenon is very often goes hand in hand with the fact that we have more and more empty houses in rural villages in Europe, especially in Eastern and Southern Europe. The more depopulated the rural area is, the more empty houses, empty real estate poverties we find there. And it's an evergreen subject of rural development experts and mayors and local stakeholders, how to use these houses. But I'm working 20 years in rural development, and I never heard that the solution would include to use these houses for homeless people. It's more or less in most of the cases the villages, the mayors, the municipalities, they would like to attract young craftsmen, teachers, doctors, health workers, which are of course necessary for vital rural life. But the social housing is just getting more and more attractive in rural areas. But in my eyes, in my personal experience, it's not about, unfortunately, I must tell you, especially after hearing your presentation, it's not about how to give accommodation or housing solutions for homeless people. And the last one is also is related to this depopulation topic, because when we do see this depopulation trend reach a certain threshold, then the real estate prices are going down, and then very poor, very low educated population goes in, especially in South and Eastern Europe, which makes many villages look like slums. And then we find ourselves back where, which was described by Mr. Wagener, like they have 4 walls, but the housing is very much not on the condition of a general European housing conditions or quality. And I wanted to only highlight these 3 angles, 3+1 angles for you. But I must also wanted to share with you my once again very personal opinion that to address homelessness and homeless people, social inclusion or housing of these people is very hard and very challenging to do it by EU tools, because as far as I see, the social inclusion projects, they are targeting the upper layer of people, vulnerable people, is just because it's a very simple administrative interest to have a higher success rate. And it's very sad to say it, but the lower we dig, the lower we target the target group. Sorry, the more the less success we have at the end of the project, and this risk jeopardized a little bit not a little bit. It risks the success of the project, and with this the fund and the financing of the project. This is my personal social inclusion related experience, and that's why those kind of projects in EU under EU funds are most of the cases targeting a high on the edge under the limit or the threshold. And not going the lowest 10% maybe. Thank you.
Thank you for your reaction, and there's still a lot of work to do. I can see. Donna, if you want to say something.
Thank you so much. So I work for Rural Housing Scotland, and I'm here today representing the European Rural Community Alliance on behalf of Scottish Rural Action. So we work very closely with them in terms of rural development across rural and island Scotland. For those that don't know, the majority of landmass in Scotland comes under rural and island communities. Population is low in comparison. However, the biggest issue that we have at the moment is housing, lack of housing, and hidden homelessness. It's been really interesting hearing everybody talk, because I think we probably would all agree that it's similar issues across the board. And it's great to hear of the work that's being carried out. And I think there's an opportunity here for really sharing a lot of the learning and working towards policy change. The biggest point that came out from that is when it's hidden homelessness, it's not categorized, it's not looked at with statistics, it's not considered as much as what homelessness is, and particularly in Scotland, it's very urban centric. It's very looking at what you see when you walk down the street of a city. And with rural and island communities, particularly in Scotland, one of the biggest issues people face and become homeless and have to live with friends or sofa surf, live in a caravan, live in garages and sheds. I mean, it's really awful, the conditions that people are in. But one of the biggest issues faced in Scotland is fuel poverty. And that has increased massively over the last couple of years since COVID. Fuel poverty has really driven a lot more hidden homelessness. Homes in rural and island Scotland are of very old and poor condition. People don't have money to renovate, to bring it to certain standards. With the big push on green energy at the moment as well, it's really difficult for people to be able to make that change. And what's happened now is one area of Scotland in particular, in the Outer Hebrides, which is where I'm from and where I live at the moment, fuel poverty has increased to between 60 and 70% of the population here is in fuel poverty. Now, we only have a population of 26,000. So it's a lot of people whose homes are in fuel poverty. And as bills have increased, people haven't been able to afford to run their homes, particularly if they rent. So they're having to leave or be evicted. And then it's a case of them being classed as the hidden homelessness. yeah, it's been really interesting listening to everybody, to what's being said. I think in particular, the work with local authorities. I think in Scotland, what's happened with funding has had a massive impact. Scottish Government do not have the funding to pass down to local authorities, who are then struggling with their own funding and looking at local policy and what can be done. I do agree that more needs to be done in terms of having a rural perspective on all types of policy across the board, but in particular looking at housing and what can be done and what support. With the work that I carry out across rural and island Scotland, what's highlighted for me is that when looking at homelessness, looking at hidden homelessness and the lack of affordable homes in general, we need to be looking at well-being. And it isn't just a case of having people live in a house and that's fixing a problem, because it isn't fixing the problem. We need to look at access to services, to healthcare, to childcare, and for the well-being of those people living in those homes. So it's multifaceted, it's looking across the board, and it's ensuring that what I do as part of my work is having that collaboration and that partnership between third sector, between voluntary organisations and local authorities and housing associations, and ensuring that we are doing the same job together. And if we come together and work together, then hopefully we can make a bigger change. It's quite frightening. Mátyás, who had mentioned about depopulation, it's the same happening here in Scotland. In rural and island Scotland, depopulation has increased massively. The ageing population has increased, and we are really struggling now because services, the budgets to services have been slashed, and that has then, all these things have such a knock-on effect and ultimately lead to homelessness. So it's been really interesting, and I'm really honoured to have been asked from Scottish Rural Action to ask me to represent today, because I feel like there's a huge opportunity here to do some work together and do some information share, and to see what we can do to make a change and ensure that those that are rural homelessness, particularly that is hidden, that it is recognised and that they are considered and that they are prioritised, so that we can make a change. Quite often, particularly here where I am, it's younger people who are suffering, or kind of young workers who are suffering from hidden homelessness. There is such a lack of housing that people are taking up jobs and having nowhere to live. So they are having to sofa surf or stay in caravans, or in unregulated landlords who have homes as well. That's become a larger issue. And then just finally, just to hit on another topic, which I'm not sure if it's affecting other countries as much as it's affecting us, but tourism, second home ownership and Airbnb has been a big issue in Scotland, where people are evicted from homes because the homes are then being used for a second home or Airbnb. So I think it highlights the lack of affordable homes that we have, the lack of social housing that's being built. And when we do present to Scottish Government and have conversations with Scottish Government, we are met with, well, we have this target, this is what we're building, but the target is nowhere near what is needed for the areas, particularly in rural areas. And as mentioned before, when you are building houses in rural areas, you have to look at the services and the well-being and the access, because not everybody has a driving licence, not everybody has a car, and they need to be able to rely on public services to access basic needs as well. So yeah, thank you so much for having me.
Thanks, Donna, so much for that great response. It's also very interesting to hear of that link in rural Scotland with homelessness and fuel poverty. I think that's a very interesting takeaway. Okay, so now we'll turn to the general Q&A. So if anybody, we have some questions that have come in, but if anybody has more, you can either raise your hand or you can pop it in the chat box and I can read it for you if you can't turn the mic on right now. So we have a first question from Miko from the Committee of the Regions. Miko, I don't know if you're available to turn your mic on, but I can read it out if not.
Yeah, here I am, and thanks for the opportunity to ask a question. all these problems are related to the society in general, and the funding has been especially mentioned, which is right. And as a politician, I'm kind of thinking that these problems are the issues that should be solved by the politicians, which are part of the problem in some cases as well. But I was wondering what has been the response from the local and regional authorities in Belgium and in UK. Have they been kind of ready to talk about the issue and the problems and to seek the solutions, or has there been some kind of a denial on the issue and unwillingness to talk about this kind of issue? When you think about rural areas, are they kind of thinking too much of the image of the area or something like that, which might lead to the attitude where the people don't want to, the politicians don't want to talk about the homelessness? That's the kind of a point of view I was wondering about. Thank you.
Thanks, Miko. So I think I'll ask Rory if you have an initial response to that question.
Yeah, I think it's a really interesting question. I suppose my initial reaction is, well, there is a mix. I think that historically, it's been very rare for rural local authorities and local politicians and councillors to talk about the issue because of the lack of visibility. And I think when it comes to thinking about why we've seen big increases in need and why we don't have the same services there, I think the lack of visibility is probably the main explanatory factor, because we know that politicians will often respond to local public opinion and sentiment, and we know that in cities the visibility of homelessness means that those elected representatives come under pressure to take action, but in rural areas that is certainly less frequent. So it's actually not until I think people raise awareness that the need is out there, it requires more advocacy and it requires more charity and kind of campaigning. I mean, urban areas need that too, but in rural areas, I think it's particularly important because the need isn't immediately obvious. It's not immediately visible. So we found that local authorities, they often haven't felt like this is a problem that they have. But when we've brought and we've highlighted it, and we've kind of framed our kind of campaigning work in a way which points to the fact that this is actually kind of in everyone's interest to tackle, that there are lots of costs locally that occur when you don't provide effective support, we found that we've got a real core of rural local authorities that have become really engaged. That's happened a bit more at a kind of official level, rather than a kind of political elected representative level. But there's definitely a space, I think, for politicians, and I think you mentioned that you're an elected representative, I think, but that I think there's a real potential for politicians and elected representatives to kind of take on this issue and go, I'm going to highlight this, because I think communities will recognize that it's there, but it needs prompting, it needs awareness raising, and it needs people's attention being directed to it, highlighting the evidence. And I think it also requires people to understand that homelessness isn't just your visible rough sleeping bag on a street. Homelessness is, the young person that's having to kind of sofa surf, for example, or homelessness is someone sleeping in a tent. I think people don't often think of that as homelessness. So I think for politicians to be able to build understanding of the diversity of experience of homelessness, the fact that it happens everywhere. Really interesting question. Appreciate it.
Thanks, Rory. We have another question coming in from Deirdre from a Northern Ireland perspective. So I can hand it over to you, Deirdre, to ask.
Hi, everybody, and thanks for being part of this call, for me being part of this call. In Northern Ireland, DePaul have quite a number of services, homelessness services, and one of the challenges that we're finding in rural areas is that there are people who are not identifying themselves as hidden homeless or as homeless at all, because they've moved back in with other family members. There could be 3 generations living in the one property, and that's generally down to affordability, lack of housing supply, and embarrassment. You know, there's a stigma attached to somebody not having their own home. And I suppose I'd love to hear people's views of how we might reach those people and empower them and their voice to their needs of a property or a house, a home of their own, and how we get that message out. I don't know if anybody else is given that experience in other parts of the world.
Thanks, Deirdre. I see Donna nodding along there. Maybe you have something to add, or Rory or Jason or whoever.
Yeah, I completely agree. It's exactly the same in rural Scotland. There's also this assumption with, particularly in island communities, that if a family member moves back, that they're just going to live with family. And that's had a big impact on how housing is viewed, and the needs surveys as well. So local authorities will carry out housing needs surveys. They don't touch the sides. They don't look at actually what's needed. What we've been doing as a facilitator is we've been going into communities and carrying out community engagement, so that we aren't the local authority, we aren't the local housing association, but we're coming in from that community perspective of being that facilitator to be able to find out that information, engage that, and find those numbers and those statistics. And that's worked really well within communities because they feel like they can trust us to discuss that with us. And we're able to then formulate all that information, that data, and report it back to the local authority, local housing association, but also Scottish Government as well, to show that this is the realistic figures. This is what we're looking at, because it is a stigma. People are embarrassed. People look at homelessness as just somebody on the street. They don't look at other forms of homelessness, and they don't consider themselves to be. And I think that's where it comes from, that national level as well, of understanding what hidden homelessness is and acknowledging it and realizing that it's just as important as anything else. So yeah, that's what we've done in Rural Homelessness Scotland, is we've just acted as that facilitator, as a charity organisation, and it has helped us to be able to gather that information.
Okay, thanks, Donna.
Maybe Jason has some other also thoughts. Is this happening in Dorset as well?
Yeah, it's the same in rural Dorset. There's that hidden homelessness, and as Donna just pointed out, the local and the national view of homelessness is people on the street presenting rough sleeping, and as we all know at this meeting, that's not the case, and even more so in rural locations. I couldn't tell you the numbers of hidden homeless, but there is a massive amount of people that are. So we, as an organisation, as I mentioned earlier, we're part of the local authorities homelessness forum. So we're trying to bring to the attention of that forum these issues. And Sharon, as an organisation, we have policies, and we have directives that each local hub of shelter follows. One of our kind of directives is to bring the plight of rural homelessness and all areas of rural homelessness, not just rough sleeping, to the attention of the local authority, and just get everybody to look at it. But it's a problem that I think we all understand and share. It's just in rural areas, people don't think that there's a homelessness issue. And I think as well, it's sometimes people's understanding of that definition. What is the definition of homelessness? It's not rough sleeping. The definition of homelessness, it's not having security or tenure. So yeah, it's something that we're very keen to address and look at and bring to the attention of local authorities and nationally as well.
Thanks, Jason. I see Bethan Gallivan has a hand raised there if you want to ask a question. I think you're muted, Bethan.
Hello, sorry, can you hear me now? Yeah, cool, sorry. Yeah, sorry. So I thought, Donna, what you said about second homes was a really interesting point. I know that that's in Wales a huge driver of well, all types of homelessness really, but especially hidden homelessness in the rural parts of Wales. And my question is about, from your perspective and in your experience, what is the kind of community's attitude to that? Because I know, like in the election last week, one of the new MPs who was elected in one of the areas in Wales where we know there's a high levels of rural homelessness, his constituency address is his parents' second home in that area, and he lives in like Surrey or something. So I suppose my question is, one, you know, in your perspective, what is kind of the community's response? Because I know that for a lot of people, they kind of feel that second homes, Airbnb is driving the economy, is driving tourism in some of these areas. But also on the political electoral level, it can be very difficult to engage when perhaps some politicians have a vested interest in keeping those second homes. So I wonder if that's a problem that you've encountered and how you kind of how you kind of deal with that in Scotland. I'm curious.
Yeah, it's a funny one. It seems to be a bit of a mixed feeling. I think initially during COVID, it was, and just after COVID, I think it had exacerbated so much that actually with a lot of rural and island communities, it drove up the house prices massively with second home and Airbnb. I myself, just to give a little bit of background here, I'm quite kind of linked to this, is I had previously lived abroad and was moving back to an island in Scotland where I grew up. And I had contacted over 40 properties to try and get a rental for a few months with me and my family. 40 Airbnbs on the island. It was COVID. There was no travel allowed. Everything was restricted. All these homes were in darkness. Nobody was in them. I contacted around 40 and every single person said no. And their reason was, we don't know when it will open again. We want to be able to make some money. And I also add that those people were also accessing COVID funding during this period. So from my perspective, it really riled me up in terms of thinking, well, how are we ever gonna, this is a young family wanting to move back, to repopulate, to live, work, bring up a family, and to get that, you know, instantly I was like, am I making the right decision? But I did eventually manage to get back. I'll give a quick example of an island actually that's going through this just now. So there's an island called Kyrie on the west coast of Scotland. They have a population of around 650 people. 47% of the homes on the island are second homes, and they are in darkness. The community in Kyrie, they are so inspirational and amazing, have taken it into their own hands because they're getting no help with the Scottish Government. They have a really great local authority, I have to say, who are trying their best on very limited budgets. But the community taking it into their own hands to contact everyone who owns those homes and to say, when they're in darkness, they're not being used, would you consider renting them out for worker accommodation, for short term, for you know, temporary workers, kind of to allow people, particularly in hidden homelessness, to have that kind of bridge that gap until they can maybe find something else. And every single one came back and said no. So I think there's that, communities are reaching out and thinking, well, this is happening and it's here to stay. So what can we do to try and change that relationship and to try and make it work for us? Yes, it's great that Airbnbs in particular, you know, drive tourism and bring people to the islands. But it's about community wealth building and legacy. It's about leaving something as well. And I think what communities are feeling in Scotland, in rural and island Scotland, is that that isn't happening. And it's very much they're in for their few weeks, then they're away, and they're not, you know, they're coming in, they're bringing their, which happens quite a lot, is that they do their food shopping on the mainland, bring it all over with them. So they're not investing, you know, any money into the community while they're there. And it's not everybody, but it's a large portion of them. And that then automatically just creates this atmosphere, and it's very much them and us. And I know with that particular community, they want to change that, and they are trying to change it, and they're trying to look, and the local authorities working with them to try and say, brilliant that you have a home in our island. That's great that you've invested in a home, but what can you do to give back to the community? How can you help? You know, if you're not here all the time, what can you do? It's very much an ongoing project, and I think it will take a long time to change perspectives and for them. But it's inspiring that they're actually doing it and they're working on it and they're trying to make a change.
That's really interesting. Thank you so much.
Thanks, Donna, and thanks, Bethan, for a very interesting question. We're almost out of time. If anybody has any other thoughts, do raise a hand, put it in the chat box. We do have one final question from my colleague Sylvia, has an interesting question.
Yeah, hi. I have a question mainly from Rory. I think coalitions are a really interesting way to work on homelessness and how to tackle the problem, and they're really making all the stakeholders sitting at the same table. But it's also a really, really hard job to do. It's something that we are trying to do with EPOCH. So my question is, how did you manage to engage with the institutions and all the entities, and how did you manage to get them keep them engaged along the time? Thank you.
Yeah, thank you. So I think the first thing to say is that it's been a very gradual process. The first thing that we did was kind of get a very small group together to commission some research. So we weren't kind of asking for participation in a coalition. There was no sort of formality to it. We got a group of 6 organizations that we knew were interested in the issue. We came together and we commissioned some research, and that research took about a year. So that was how it started. Once the research was then published, we shared it and we got a broader range of partners to go look at this, and we used the research as a bit of a galvanizing moment. So I think it was, I'd say, getting a smaller group brought in early, trying to create something that people can rally around. So rather than just, we think we should do this, do you want to join? Make them feel a part of producing something. Once that's then produced, really trying to make that a big media moment, a big policy and political moment. And then what we did is, once that was published, we got a lot of organizations to sort of share it. And then we got everyone together and went, okay, how do we build the momentum here? We recognize this is clearly something people want to talk more about. We know that the level of need is high from the research, and we know that there's interests from kind of governments and others to engage too. So then we kind of created a set. So we asked people want to kind of be a part of that. People generally were positive, but we kept it really flexible. So we said, you're not signing up to commit to doing all these things. You don't have to do anything for now. All we want is that you have a principal commitment to working to end rural homelessness, that you will do a set of, you will, where possible, raise awareness and attention. And we had a set of principles, and every organization that signed up agreed to those principles. But we said, we're not going to sort of run off and do different things that you're not consulted on in your name. So I think it was that early start, galvanizing moment, and creating a lot of flexibility and reassuring people that it doesn't have to be a big time commitment. But it's just that statement of intent. They've been the main ways we've achieved it, and that's really exciting that you want to take a similar approach. And if there's anything more we can do to kind of share our experience and be a part of that, then I'm really happy to.
Thanks, Rory. That's really interesting to hear from EPOCH as we continue working with a lot of stakeholders. I see Martin has a hand raised.
Yeah, I just wanted to react also to that, because it's quite funny. In Belgium, we have since 30 years a law which obliges each local welfare, public welfare actor in each municipality to organize the help to homeless people. So in fact, on a law basis, everything is there. But the problem is really about the mindset of people, as a lot of people said. Politicians often see, oh, we don't have rust sleepers, we don't have this visible part like in cities. And so it's just sometimes a house burns, sometimes there's lack of housing and here and there. And so they push it all the time away. And I really think there's a thing about gathering the data, because they can't push it anymore so easily away and seeing, okay, you have this number, you have 30 people there, you have 20 people in tents, and that they act there. And I think things are coming slowly out, and I'm quite happy with this research part, because when I look back 20 years ago, it was always social workers saying, yeah, we have a lot of problems, we have a lot of people in difficulties, but they hadn't the data, they hadn't things to argue really with politicians about what to do and how many housing solutions we need. And so especially like in Luxembourg and other parts in Northern Flanders, and so, or even, I haven't spoken today about it, but poverty in one of the richest province in rural areas is quite high, and they're the most forgotten poor people because they're living in rich provinces, and we also have these problems with people pushed away because housing markets are rising, and so they go away from their local. And I think that there's something coming back in the political discussion, but let's say we have a new government 2 days ago, so it's very difficult to say about what they will be doing. But it's I think it's really important to raise this awareness much longer. It's not so much a discussion of what political party, but mainly about there are national parties and national deciding, but it's a lot of things have to be done at the local level, and they have lesser services, but they still have services, and that's the thing what the colleagues Rory and Jason said. It's the difficulty about reaching out. It takes a lot of time, and so to bring the people in. And yeah, I just wanted to direct something about this. And it's very different in which situations you are, because there are very poor rural areas, but also very rich rural areas and very touristic rural areas. It was just the last comment, but we have one municipality that 65% of the homes are second homes. And so when you go there in October or somewhere, everything is completely empty. And so and people are just leaving out, and this is also something about communities and destroying these communities with people coming from elsewhere, having nice place to stay. So just want to say something, because it's really changing mindsets of politicians from all, and a lot of local politicians are interested in it, but also a lot of local politicians are just saying, oh, it's not our problem, it's not here, we're going to be an attractive municipality where everything goes fine, and this is really the most challenging throughout the years, to say it like this. Yeah.
Thank you everyone. Thank you for all the speakers. I think it's time now to end the webinar. But based on the conversation that we've been having for a few minutes now, I think there might be some room for another activity on rural homelessness in EPOCH Practice in the future. So it's good if we stay in touch. This webinar will be available on our YouTube account, and we will be back after the summer break with 3 more webinars. So make sure you stay updated. Thank you so much. Have a good day and see you soon, I hope. Thank you.
Thank you very much.
Thank you all. Bye-bye. Bye.
Thanks, everyone.
Thank
Happy
you.
weekend.